Teaching Hospital. What are your thoughts, first of all, how things have played out? First, there was an increase that people have clearly shown that they've paid for. Management is now saying that they did not even approve it. Talk of take it to Parliament to be approved before being charged. Whilst it was being charged at the Korle-Bu Teaching Hospital. What do you think?
Yeah, thank you, and good morning to your cherished listeners, and good morning to your studio audience as well. In fact, when we heard of this situation, it's been very worrying to the entire public, not the kidney patients only. And then as we continue to dialogue, we think the ministry has now taken up its role as the sector lead in communicating to its agencies and other actors in health to be able to put this situation to the appropriate measures. You know, we think dialysis is one of the essential commodities in health that should have been catered for even by government. And for that matter, if NHIS could have looked at situations like that, would be better. Korlebu, as we know, is still an agency within the ministry and should not be doing things on their own, as we saw and have heard. They are mobilized themselves to do the right thing, as we have seen in their communication, by seeking approval from the Parliament and then the necessary steps to get authority from the ministry before they do. We know the economic situation in Ghana is very difficult and hard for everybody. And if kidney patients would have to suffer this with such an increment, it is very distasteful to us as DSOs, and then we think it is not in the right it's not in the right case. So we all continue to do this dialogue and see how government could subsidize to take this burden out of kidney patients.
Now, having said that, what do you think should, because from what has happened at the Korle-Bu Teaching Hospital, there are those who talk about the glaring show of incompetence on the side of the management and then the person in charge of the unit, that somebody needs to be held accountable. Because imagine you are a patient who is struggling to even pay the 380. And you turn up and they are telling you about 700. The trauma alone. What should happen at Korle-Bu? Should somebody be held accountable for everything?
Yes, very much accountable for everything. The unit head or the departmental head of the dialysis unit is not the total, it's not the final authority in Korle-Bu. And I had the CEO of Korle-Bu speak to this issue yesterday. And it's assumed, or to me, it seems like he is not even aware that some of his departmental heads are charging people these amounts. If the charges are not coming from management, then such a person should really be looked at, and then the should be merited with the needed sanctions that is due him. Because you are just a line manager, and the whole CEO has to sought even approval and authority from Parliament and then the sector. And he has not done that and has not communicated any changes to you. If you could use your power to do that, then you are not having the interest of Ghanaians at heart, and particularly that of the kidney patients. So we think he should be warranted and needed sanctions that is due for such an act. It's an act of insubordination, and it has brought the whole country into this state of worrying.
But what needs to do going forward? Because they have also, the explanation they have given is that the taxes that are being imposed and the fact that they used to have some exemptions that are being withdrawn, that necessarily will mean they have to increase the cost, even if not to 700. At some point, they have to seek parliamentary approval to increase the cost. So what do you think should happen in this case?
So critically, if you look at it from the point of view of our health insurance, some of the basic things health insurance are paying are probably the same basic things that the people or the patient would be able to afford. So there should be a situation where health insurance remodel to look at the cost on healthcare, the ones that are critical to the health of society that they cannot afford. If you look at dialysis and how much it costs and the number of times kidney patients have to access it could be any of us. And, the majority of the people has their regular incomes would not be able to afford such a cost. So if some of these cases are what our insurance will cater for, I think we would do us a lot of good than the normal OPD cases, which in many cases people could be able to afford on their own. So if we could reconsider how much we contribute to the insurance, then we also write off all the charges on the insurance. I'm talking about we moving the insurance, contributing the insurance into the consolidated fund. This is something we have spoken about for a number of years, several times, that no, health is a concern for all of us. And for the health insurance fund alone, it should not be taxed, what we normally call capping. So if you look at it today, it is not the same amount that we contribute as people in the country to the insurance that goes to the insurance. So insurance is also able to do what it thinks it can do. Otherwise, we have to stop capping the insurance because it is the health of the people, it is the health of the manpower of the country, it is the health of everybody in the country. So we also recommend that some of these critical ailments should rather be considered, other than most of the OPD cases that in so many times we see being cleared by the insurance.
And then the taxes itself? Because if these taxes are being, if the public sector is filling it, imagine what is happening to those who have to use private healthcare.
My brother, it's also about time we really prioritize, we do a proper mapping of the individuals and their economy. I mean, the economic situation of every person in the country, and look at the taxes thereof. We should look at the type of work people do. We should also look at what is contributing to our health insurance, not generally, in terms of jobs, in terms of the availability of resources, and so on. If we look at alcoholic beverages, if we look at tobacco production in the country, if we look at our tourism situation, if we look at petroleum and all that, we could easily identify that there are areas that we can tap some resources to contribute to the health of the people in Ghana. But everything is generalized, and then how much goes into it? You see, sometimes if you look at a worker, and then he's contributing, let's say, about 24 cedis or 25 cedis annually towards insurance, and then you get sick critically, and then the whole insurance has to take care of the number of us, leaving taxes on petroleum products, leaving taxes on alcoholic products, leaving taxes on tobacco, and so on and forth, which also contributes heavily to the diminishment of the health in our country. Then we are doing a lot of disservice to ourselves. So we think we cannot generalize everything as it used to be, that this is a tax that is going for everybody. We should be able to map out certain services and then industries within our country, and then allocate some taxes to them, and that taxes to be drawn specifically to support the health system in Ghana. And for that matter, probably create an emergency fund out of this to support all other emergency services, including the dialysis situation we are looking at to do. And this is not done, and then it is becoming a worrying situation to all of us, where insurance will have to come and then always tell us that it is not enough, they don't have enough money, because all their money is capped and then government is using it for other things. It is not good at all. It's about time government becomes more sensitive to the health of the nation, and then rather look at how we can raise enough money to fund our health situations in the country.
Let me conclude by asking whether we need to have, in the wake of this, have a bigger discussion on the cost of healthcare in the wake of our crisis, the crisis of prices increasing, going to the roof? Is there that discussion that we need to have and think about how we can make healthcare cheaper, even in the midst of the difficulties?
Yes, I perfectly agree with you on that. If we could hold a referendum or town hall meeting to ask people to share their concerns about how we can make health cheaper, quality better, and then safe, if we could put our systems right so that people can even access the facility, access services that are due them without going through other protocols and so on and forth, will be better. So the challenges we have in our health system now is even just beyond the funding. There are systemic issues, there are funding gaps, and then all these issues that we are talking about comes to play. So I believe the same way we put ourselves together when we want to probably create regions or create districts and other things, we hold such referendum. This is an emergency situation. We could even look at it in terms of national security issue, and then also create the same platform bigger across the country, regions and districts for people to come in and share their views. We consolidate all those information together and look at how best we could design our health system again and look at the things that people say they want and how they will contribute to it to solve the challenges within our system. You know, invariably, you could agree with me that even preventive health is something we don't talk about at all in this country. Nobody sets up a gym, or people do not move to wellness clinics just to check their BP and other things and then come, because you cannot find them anywhere. You still have to go through the facilities to get these things done, and at the end of the day, you have to pay for them. If we could also concentrate more on preventive health, it would also help us than getting people sick for insurance to pay. So I have a lot of policy issues regarding our insurance system. For the fact that they need more money, they should also look at how they could create avenues for people to be able to exercise and then protect and prevent themselves from getting some diseases for them to be cured. And this is what we are not doing right. And I think we should give more attention to it moving forward.
Thank you very much for speaking to us, Mr. Amissah Nyarko.
Thank you, sir.
Bright Amissah Nyarko is President NGOs in Health, speaking to us on this issue. And of course, and I recall, I always tell this story because I was there when it happened.